If you want to successfully recover from a knee replacement, you need to do this one thing. What's up, y'all? This is Carolina Doc PT, and if you have had a knee replacement recently, or if you are thinking about having a knee replacement, you need to do one simple thing to successfully recover, and that is do your exercises as your physical therapist has recommended you to do them. That really is it for the vast majority of you who are watching this video. The vast majority of people who have had a knee replacement, if they will do the exercises and listen to their physical therapist, they will successfully recover from that knee surgery. Okay, it's yes, there are potentials for complications. Yes, some people will go through that. That is a small percentage, okay, and that's not anywhere close to the norm for these types of surgeries. I see I have heard from people who are thinking about having these surgeries. Actually, I had a patient just this week who needs a knee replacement but doesn't want to go through with it because she doesn't think that she would do the exercises sufficient to successfully recover. And I've got to say, I commend that patient for understanding that. She knows herself well, and she said, you know what, that's not something I'm going to do, so I should not do that. If you are in such pain that you get to the point that you understand, okay, I need a knee replacement, and I understand what's involved, and part of that to successfully recover is that I'm going to have to do exercising. I'm going to have to straighten the knee even when it hurts, even when I don't feel like doing it. I'm going to have to bend the knee even when it hurts, even when I don't feel like doing it. And I'm going to have to do that because that is what it takes to successfully recover from these types of surgeries. If you understand that and are able and willing to do that, then you're going to be fine. You're going to make it through, okay? There are ways to deal with the pain. I have a video. I'll link it at the end of this video that talks about, I think I have 21 different ways to help control pain. There's a lot of ways, not just all medication. Matter like most, well, as I say, I think there are 21 examples that I made in that video. One is medication. Okay, there are lots of things you can do to help manage your pain, but if you don't exercise and you don't do what it is that you're supposed to do to get that knee bending, the surgery, even if it went well, is not going to be successful for you, and you're going to wind up having way more problems after the surgery than you had before. So my patient, who knows herself very well and says, look, right now I don't feel like I would successfully rehab this knee by doing the exercises that I need to do. She knows herself very well. She should not have a knee replacement. If you are not going to do the exercises that you have to do after the surgery and maintain them every single day, okay? You can't do them just a little bit. You can't do one or two and then skip a day and then do one and then do three the next day and then skip 2 days and then do one exercise and then one day do 10 exercises and then for the next 3 days do nothing, and continue on in that way and expect to successfully recover from having had a knee replacement. This is the type of surgery that you have to work to get the joint moving. And that is completely independent of what the surgeon did with you. I always tell patients that have had these surgeries, you have to assume that your orthopedist not only did the surgery successfully, but that he did it very well successfully. Okay, so that he did a very good job. That is the assumption when you are coming out of working with an orthopedist, until such time that circumstances dictate that, okay, that surgeon did not do a good job. That is rare in my, that's not to say that can't happen. I can think of one surgeon in particular who no longer practices in this area where I work, who really did a horrible job with a few knee replacements. And I'm glad that he's no longer practicing in this area. He was not a very good surgeon. So that's not to say that every single surgeon is great. They aren't. But the assumption is that they are doing a very good job, because most of them, the vast majority, are really good. Okay, so if they successfully do the surgery, they do a very good job. That means that they have put in a new device inside of your knee that will allow you to bend and straighten that knee. It will allow you to return to functioning. It will allow you to walk. It will allow you to move successfully. So if they do their job, then the rest of that is on you. You have to work and make that knee move. Okay, just because the joint is there, if you don't do anything to get it moving and to get your muscles to make that knee move, then it's all going to be for naught. The surgeon might have done the best job in the world, but what you have done with it after that is going to lead you to having a failed rehab. And then that's going to likely lead you to a year or two later having to do a redo, and you're going to have to do it all over again. So I really cannot stress enough, there is just one thing that you as the patient need to do after you've had a knee replacement to successfully recover and get back to life, likely better than you've been experiencing in the last few years. And that is to do your exercises for that knee just as your physical therapist is recommending you to do. And that is when you're in the hospital with the acute care physical therapist, when you have home health come in, when you're working with them, and then when you go into outpatient after that. All of your physical therapists that you're going to encounter in the different settings that you will encounter them as you progress. And also rehab. Some of you may go to rehab before home health, or sometimes instead of home health. In all of those different settings, listen to your physical therapist. Do what they are asking you to do. They are not guiding you in a wrong direction. They are helping you to successfully recover. Okay? That is what it takes. That one thing is all you have to do. All right? Now, if, like my patient who I mentioned earlier that I saw earlier this week, you feel like you cannot do these exercises and are not willing to work through them, then you shouldn't have a knee replacement. You shouldn't do the surgery. You shouldn't do this. You should be self-aware, as my patient was, and say, you know what, right now is not a good time. Now, does that mean that that's always going to be your answer? No. As circumstances dictate, you may very well change that opinion. I certainly have had patients who got to a point with their knee where they felt like, you know what, this was hurting so much that I didn't care what pain I was going to have to go through, what work I was going to have to do. I decided I'm going to do it because I'm tired of having the pain. I'm tired of having the dysfunction. I'm tired of not being able to go around with my family and my friends and do the things that they're all doing. And so the circumstances for them dictated that, at some point it was worth it for them to do the work that was going to be required for them to successfully recover from this knee replacement. But if you're not going to do that and you're not willing to do that, you should not have the surgery. You should go a different route. Go to pain management and try to work in that direction. You can, I would say, still wear out physical therapy. There a lot of research supports strengthening the muscles of the hip. There's a lot of things that you can do to try to get where that knee is not being used quite as much, so that way the pain is not quite as bad as it otherwise would be. The worst thing you could do, bar none, would be to just sit and do nothing about your knee pain, whether that's having a surgery or whether that's after having had a surgery. Choosing not to do anything for that knee is a choice, and it's a choice that's also going to lead you in a bad direction. You need to do something, whether or not it's have a surgery or whether or not it's seek physical therapy care and wear that out, strengthening your hips and doing stabilization exercises and all the things to help that joint not work quite as hard. So I don't mean this video to be like a doom and gloom. I just am kind of laying the facts out for you that exercise and working on that knee is critically important to successfully rehabbing. This is not the type of surgery where you go in, they do the surgery and then you come out and give it a couple of days or a couple of weeks and you don't have to do anything else, you're better. That is not the type of surgery that this is, and you need to understand that before you go into having that surgery. So as I said, I will link a video on ways to manage pain, because that's really the main concern that most patients will express as far as doing exercises and not wanting to do them. So there are lots of ways to help control this pain. And let me also end this with this. You can successfully recover from this knee replacement surgery. Okay, I see these patients all the time. We work with them, and I'm telling you, you get the vast majority of these patients, you get to them 6 months after the surgery and they are saying, this is the best thing I ever did. I should have done it sooner. So that's not, as I say, to make light of the work and or any of the pain or any of the things and the struggle that they went through to get to that point. But you can get there. The vast majority of people will get there if they will just do that one simple thing. Do your exercises as your physical therapist is requesting that you do. Okay, so I hope that this has been beneficial for you. If it is, please like this video, share it out to any family member or friends that you feel like are going to need to hear this as well. And do look at the link below, and we'll can go over some of those ways to manage the pain here. All right, y'all have a good one. Later.